Hi, I am Vijai Shankar. I am from Helyoxn Healthcare Solutions Private Limited. We are based at IIT Madras Research Park. We are into IoT healthcare product, and we have developed a product called Fever Watch. It's a very innovative product. We even won the most innovative product of the year award from Medical few months back. And I just wanted to talk about how the industry is heading towards. Especially today's consumers demand completely different that we see from various things. When we look at the movie going experience to flight ticket booking experience to cab, everything has changed in the recent past. But if you see earlier, we were going to the shops, now shop is coming to our home. Earlier we were going for ticket booking, if we remember, we were going to railway station to book our tickets, and today train tickets or flight tickets can be booked out of your hand through your cell phone. Now entire thing is changing, but in healthcare, if you see old movies, there the doctor was coming home. Today we are going and waiting for the doctor. Only healthcare industry is moving in this direction. And do you think this can be changed? And if this has to be changed, what are the things required? This is one of the thought process which was provoking us to think, what is next? What has to be done? How this can be taken to the next level? So when we were thinking about, something struck to us that something else is happening across the globe, which is called IoT, Internet of Things, and which can take the healthcare to the homes, to the pockets of each individual. The personalized healthcare which we are all talking about, that is possible only when we have Internet of Things is possible. And where to start this Internet of Things? Who is the predecessor for us? Who is successful in this industry across the globe? We were really searching for it, and to find, we couldn't find the right kind of a company who has marched towards this and seen a success. That becomes even more difficult for us to decide in which direction we have to go. One of the simple thought we got when we were thinking about this is how to bring the simplest of the simple thing, which is common, as common as possible. When we talk to anyone, they know there is a problem there. And if that problem, if we can provide a solution in simplest format, what can be that? Where should we start? How to get it done? That is when Fever Watch was born, because fever is something no one can tell. We have never experienced it. When I talk about heart attack, anyone can tell that will come to my neighbor, not to me. That's the kind of a feeling everyone has got. But when I tell fever, yes, someone is going through in my family, or I am expecting that someone has just now got that fever problem. So a problem anyone can understand. So that is what we thought. The simplest of simple thing is thermometer. And to my surprise, when I was thinking about it, there are hundreds and thousands of models of thermometers are there, all give instant information. But what we need as a doctor, a doctor needs a continuous measurement of temperature. Based on that, now the doctor recommends the parent to give a medication. But that's not the situation. We don't have a tool to measure continuously and then provide a solution. So that is when we thought it's more exciting for us to come out with a solution which continuously measures and provides a kind of a trend in the cell phones of the parents. And then we also found that the same product can be used elsewhere inside the hospital, where a nurse is expected to repeatedly measure the temperature and then provide a solution. When the doctor comes, she provides a trend and graph, and then she has to do all those things manually. Anything repetitive has to be automatized for bringing in the best efficiency in an organization. How are we going to do it? This simple device does it automatically. So no need to. So one burden for the nurse is less. So this is only an example I'm talking about. There is 100 other benefits which are going to be possible. If we think of personalized healthcare, which customers are started demanding in other industries, they are going to demand in healthcare also. If we have to bring that kind of experience to our customers, the patients, then IoT is inevitable, and this need to be adopted, and this is the happening thing of the hour. Transforming Healthcare with Information Technology THIT conference, which is happening now. It's a great thing. People with like-minded like us have come here, converged here to see how healthcare can be transformed to the next level. What is it required? How an IT which has done so many things elsewhere can contribute a meaningful an application which can be experienced by everyone in the vertical up to the last person who is in the rural. And how are we going to do it? With a lot of big questions about healthcare like affordability, reach, these are going to be answered through this. This is my biggest belief in participating this, and this is going to be answered in this conference. And through this, like all the people who have come from the entire this part of the globe are going to get benefited, and as an organization like ours, we have a great hope this particular conference is going to be highly successful. Transforming Healthcare with Information Technology Conference THIT is a great platform, and it is one of the biggest of this form in the entire nation, or I can even call it as in this region of this world. And all the great people, great thought leaders of this industry, whom they think that IT can definitely transform healthcare, have converged here. And I am so proud to be part of this particular forum and being part of this particular participating in this conference. I'm really happy. What I think, all the ideas, convergence of all the ideas of these great people is going to be delivered, and the people who are attending, and then when we go out, this is going to transform the experience the healthcare is going to provide in every level of consumers of this healthcare. Every participant in this conference are going to gather the information which is being collectively put here, and when we go out as after this conference, I'm 100% sure the way we think is going to be completely different from the way we have been all this time. And this is going to provide a different kind of experience to every receiver of healthcare, and this is going to bring a different experience to each of the patients, and thus this HTIC is going to provide a different kind of it will transform the way healthcare delivery is going to be in the future. I'm very confident of it. Thank you.